We will continue with the discussion of different types of immunity. And in the last video, we have seen about innate immunity, different levels of innate immunity, and also the different factors that influence in innate immunity. Here in this slide, you can see different mechanisms of innate immunity, in which there are different strategies that body usually adopt to attack foreign substances. Right, all these are non-specific attacks. You can see the mechanisms. There are anatomically specified defense strategies. There are physiological reactions of the body. There is phagocytosis and inflammation. So all these are the major mechanisms of innate immunity to resist foreign substances. And we will have a presentation separately for discussing all these different mechanisms. All right. So we'll continue with the acquired immunity here. The types of acquired immunity, as already stated, are of two types: active immunity and passive immunity. All right. So there is subdivisions of natural and artificial for both active and passive immunity. So what is actually acquired immunity? That's already we have seen that acquired immunity is the immunity which is acquired by an individual during his lifetime, during his or her lifetime, usually acquired by exposure to an antigen, right? And the immune system identifies the antigens, and a resistance is developed by the immune system, right? An immune response will be mounted against this infection. And normally there is a natural process in which you can find a lot of examples for certain diseases. We recover from the infection, we recover from the disease after around 2 weeks or 3 weeks, and after that the body maintains a resistance against that infection, right? So these kind of resistance is acquired, right? We do not have a previously developed immunity, but rather this immunity is developed by the immune system after exposure to a particular agent. So the different features, or the one word explanation, you can say the various specific features, like specificity is one of the important feature, then diversity is a feature, then the ability to differentiate self and non-selves, then also the memory. These are the four different features of acquired immunity compared to that of innate immunity. I'm not going to explain all this again. So these two cells are the major cells involved in the acquired immunity. Both have different types of effector activity. B cells will produce antibodies. At the same time, T cells will have two-phased attack. One is executed through T helper cell, which is playing a central role in activating all the other immune responses, and cytotoxic cell will secrete the cytotoxic chemicals in order to destroy the foreign substances. And what is active immunity? So now we are going to discuss about the different types of acquired immunity. So first we will see what is active immunity. Active immunity, as the term indicates, there is an active involvement of the immune system of the host body. That's what it means. There is an active involvement of the immune system of the host body, right? So there is resistance developed by an individual, usually against an antigenic stimulus. All right, and there will be production of antibodies and other immunological cells activation, and they ultimately resist the foreign substances. And definitely there will be a latent period, because the immune system takes some time in order to get activated. So in between this period, the individual will suffer certain symptoms of the disease. That may be fever, that may be headache, that may be vomiting, that may be pain, and other various symptoms. That's what we usually call a disease, right? So the individual will suffer from a disease, and after a period, that period is called a latent period. After that, the immune system counterattacks, right? There is a counterattack by the immune system, and by that the individual will be recovered, right? And also there is often a negative phase. That means initially the body becomes more susceptible to various infections because of the attack by the foreign substances, right? And the last point is very important. Once developed, it provides a long lasting protection, right? Because these are developed one and they maintain memory, and hence they will maintain they will provide a prolonged protection comparatively, right? And various mechanisms are there, like humoral immunity and cell mediated immunity. That means there is a antibody mediated response and cell mediated response in order to execute these active immunity. Because since the body's immune system is involved, definitely antibody production and the T cell activation will be there. Then the two subclasses of these active immunity are, one is natural active immunity and the other one is artificial active immunity. So natural active immunity means there is a natural infection. When you have a natural infection, and as a result of this natural infection the immunity or the immune system is activated, then it is called a natural active immunity, right? That means it results from either a clinical or inapparent infection by a microbe, right? There is an agent, external agent coming into the body, and as a result this body develops a resistance. This is called a natural active immunity. And you can find a lot of example, like a person recovered from attack of measles virus. Usually this is developed as a result of an infection by the measles. You can find another example, like in case of chickenpox. Usually the virus attacks the body for the first time, and this individual will suffer the symptoms, and after that he recovers, and his immune system maintains the memory, and that usually provides a lifelong protection, right? So these are long lasting protection will be provided. And usually most of the viral diseases are protected, or viral infections are coming under this category, right? In short, natural active immunity is nothing but you have an infection and you suffer from the disease, and after that immune system counterattacks and body recovers, and the immune system maintains the memory so that you do not suffer for a second time the same infection. You will not be attacked. Then second class is artificial active immunity. By the artificial means you can induce our immune system, and the very popular example is vaccination. Vaccines are nothing but live or attenuated preparations of microorganisms, right? And there are different types of vaccines. You may know that there are different types of vaccines. There are live vaccines, kill vaccines, subunit vaccines. Various sorts of vaccines are available currently, and these vaccines are the very common concept, or the very basic principle of vaccination is that these vaccines consist of the antigenic substances, and these substances will induce the immune system, and in such a way that the vaccines are developed in such a way that they contain substances which will induce the immune system, but they will never cause a pathogenesis. They never induce a pathogenesis, but they can induce immune system, right? So the vaccine mediated immunization, or the vaccine mediated activation of the immune system, is coming under artificial active immunity. Now what is passive immunity? Passive immunity is, on the other hand, to active immunity. There is no active role played by the recipient's immune system, right? There is a passive role played by the immune system of the host body. There is a resistance which is transmitted passively to an individual, and this individual will experience a resistance. This individual will have a resistance, but this resistance is not a possession by his own immune system, but rather this is supplied from outside, Right, the resistance is supplied from outside by various means, and the immune system does not play any role in maintaining the resistance. Right, there is no antigenic stimulus at all, as we have seen in active immunity, whether it be active, natural active or artificial active. In both cases, there was an activation of the immune system. But here in passive immunity, there is no antigenic stimulus, and instead, the preformed substances are administered. It could be antibodies or any other substances. Right, and there is no latent period, no negative phase, which already we have discussed what is latent period and negative phase. And one of the limitation also is that this is a transient immunity. That means this immunity will prolong only for a short period. It's not a long lasting protection, it's a ready made protection, and it will be available only for a short period of time. Right, and there is no secondary type of response. That means there is no memory at all, since no immune system is involved. Usually is comparatively less effective in terms of active immunity and other. Right, and usually this is usually we administer this kind of immunity when we need a sudden protection. Right, in case of emergencies, we use passive immunity. Then this also we have been using in two ways, either natural passive immunity or artificial passive immunity. Natural passive immunity is the natural administration. There is a natural what naturally this resistance is transferred from certain sources to the host body. And very common example is the resistance transferred from mother to the baby or to the fetus. Right, there is an antibody called IgG which can cross the placental barrier that usually present separating the fetus and the mother body. So the antibody can cross this placenta and enter into the fetal blood circulation, and this antibody provide protection for the fetal body. Right, and also there is antibodies like IgA, which are transmitted through, or which are passed through colostrum, which is the first breast milk. And this colostrum is having a lot of immunological properties, and one of these properties that there are antibodies also, and these antibodies also will provide a kind of immunity. And you have to remember that in both these examples, the immune system of the recipient doesn't play any role, but rather the ready-made antibodies are transferred, and these antibodies will provide protection until these antibodies are completing their life cycle. Right, so this is what we have to see in case of natural passive immunity. And the second one is artificial passive immunity. And here the passive immunity is transferred in an artificial manner. This artificial manner means in case of very emergencies, we use a certain immune sera or certain hyperimmune sera or plasma like substances which have this antibody or other immune response substances of an individual, and that will be taken out and will be used to treat a patient. Right, so this is nothing but the resistance passively transferred to a recipient by administration, usually like antibodies and other substances. You can use various examples like hyperimmune sera of animal, then convalescent sera, pooled gamma globulin. So all these are sera or plasma substances, widely used for prophylaxis rather than therapy. This shows that what is hyperimmune sera, convalescent sera, and pooled gamma globulin. These are nothing but these are all are antibody solutions. I'm not going into the details of this discussion. Right. So these are the different agents used for passive immunization. All these are listed substances like a horse antitoxin is used for botulism infection. Horse antitoxin is again used for diphtheria. Then pooled immune gamma globulin pooled serum is used for measles and for rabies also. So like that, different solutions, different sources being used for uh, imparting a passive immunity, right? So here is a comparison for active immunity and passive immunity. Active immunity is induced by infection. Passive immunity conferred by administration of ready-made substances like antibodies. It's long-lasting in case of active immunity, and it's effective for protection, but it's short-lived and less effective in passive immunity. And there is a lag period in active immunity, but there is no such lag period in passive immunity. There will be an immediate effect for passive immunization, and exposure leads to immediate maximal response. Lag time between exposure and maximal response in case of passive immunity. So these are the different comparative strategies for active and passive immunities, right? There is memory present for active, there is no memory, and negative phase is present in active and absent in passive. And usually active immunity will not be applicable for immunodeficient person, right? That you can easily understand, but it's applicable in case of passive immunity. And usually vaccination kind of things will provide or used for prophylaxis kind of things, and usually passive immunity used for treatment of certain acute infections. So these are the different references I've taken. So I hope you understood the various types of immunity. Thank you for listening.